Good morning, afternoon, evening from wherever you are connecting from. ISSUP Kenya is delighted and honored to host this September's webinar. I'm Lambert Igara, ISSUP Kenya Treasurer, and I'll be your moderator for today's event. Our distinguished speaker for today is Mr. Sami Ombisa, a certified wellness coach, life coach, and mental health coach, and a member of the American Association of Christian Counselors. He is also the director of Vitality and Bahari Wellness Centers, an international certified professional, and a member of ISSUP Kenya chapter. The webinar's title is Integrating Wellness in the Addiction Recovery Process. ISSUP is an international membership organization that is focused on the development, support, and representation of a professional workforce with a field of substance use prevention, treatment, and recovery support. We address our mission by sharing the latest evidence-based, ethical, quality information and promoting opportunities for professional development, connection with other professionals, and doing so across borders and across professional fields, nationally and internationally. ISSUP Kenya is the local chapter and works to meet the needs of our members locally. We do so by hosting webinars that enable us to increase our reach, training, knowledge, sharing, and network opportunities. As always, we encourage those of us who have not yet done so. Do consider joining your local chapter of ISSUP for information, networking, and training on drug demand reduction matters. Before I hand over to our speaker, here are a few housekeeping announcements. The webinar is being recorded, and the recording will be available in a day or two on our issup.net website. A copy of the presentation slides will also be available there. Certificates of attendance will be emailed to all those that registered via the go-to registration page with the email you used to register for the webinar. Please write in any questions you may have on the questions chat box in your control panel. I will collect them and present them to Sami Ombisa at the end of the presentation. Please note that this webinar is provided for information purposes only and does not constitute medical or treatment advice. The views presented here are those of the speaker and not necessarily those of ISSUP. I therefore take this opportunity to welcome Mr. Sami Ombisa. Enjoy the webinar. Thank you.
Thank you so much. Thank you so much, Lambert, for that wonderful introduction and the housekeeping rules. Welcome, everyone. And this evening, we are privileged to be talking about integration of wellness in addiction recovery. And it's a wonderful evening where our objectives to start with will be to define the concept of recovery and wellness in accordance to SAMHSA. We shall also look at understanding wellness in recovery from a whole person strength-based approach. We shall also be looking at discussing the inclusion of wellness in recovery-oriented systems of care for addressing behavioral and physical wellness. We shall discuss specific food nutrients necessary in recovery journey. We shall also learn specific benefits of balanced diet, exercise, stress management, mindfulness in recovery. And then lastly, at the very end, we shall look at some of the tips that are necessary and important for recovery professionals with recommendations that we can take home for the purposes of improving our centers or just including in whatever we are already doing at our centers. So sit back, relax, and enjoy. We start with important terminologies here. And the first one is looking at what recovery means. Recovery, according to SAMHSA, is a process of change through which an individual realizes their health and wellness and lives a self-directed life, striving to reach their full potential. And the word that I want you to focus on here is process. And we see also two other words, that is health and wellness. It goes on to say it's a gradual process with distinct stages that entails personal growth and return to holistic well-being. Secondly, we look at the word wellness. It's an active process of becoming aware of the choices towards healthy and fulfilling life. And that means striving to achieve optimal wellness means decreasing stress. As we know, some of the reasons that would have taken somebody into addiction would have been stress. Then it reduces the risk of illness, and that's why we want to help this person to restructure their life into recovery, and then strengthens social life, because most of the people who enter the addiction treatment centers would have had bad social interactions with their family or friends and things like that, and then the emotional health. And we look at it from a point where we say wellness is more than just being healthy. There are more other things that need to be done. The other terminology that we look at is the ability of the nervous system to change its activities to respond intrinsically and extrinsically from the stimuli, so that it reorganizes the structure and functions or its connections. And that is what we call the neuroplasticity regeneration. And this one is where we look at some of the nutrients or some of the foods that are essential when it comes to somebody being able to achieve that. Things like the chia seeds, the walnuts, the avocados. This concept is often discussed when we're talking about brain foods or superfoods and foods that promote good health. Then we shall look at malnutrition and undernutrition, where malnutrition is a condition that develops when the body is deprived of essential vitamins, minerals, and other nutrients, while undernutrition denotes insufficient intake of energy and nutrients to meet an individual's needs to maintain good health. Undernutrition is synonymously used with this malnutrition. So our first point, according to SAMHSA, wellness is about whole person, strength-based approach. SAMHSA envisions wellness not as the absence of disease or illness and stress, but the presence of a positive life purpose, where the person who had gotten into addiction is being redirected back to live a purposeful life. Then there is the satisfying of work and play, joyful relationships, which you have already seen in the introduction, a healthy body, because without a healthy body, this person is weak, this person is feeble, they are not able to execute the work that we are talking about. Living environment and happiness. It's only out of happiness that you will decide to have reached a point where your well-being is considered to be optimal. So why do we need wellness in the first place in the recovery process? There is quite some research that shows that wellness, people living serious mental and substance use disorders are dying decades earlier than the general population. Yet these mental health disorders and substance use disorders are preventable. So wellness is coming in to help us with designing programs for those in recovery to attain the social support, the goal setting that is required to restructure their life to the right direction. Wellness programs are also known to contribute to one's overall health, that is the emotional, the mental well-being. Also, wellness helps the behavioral and physical health of that individual, and it's always geared towards prevention, because wellness programs have been used extensively in the prevention. So as soon as this person leaves the treatment center and also wants to go back to the community, we need to continue giving them the same messages of prevention, but using wellness components. There's a huge gap between the aftercare services, and most of the time, those few that are applying those services also don't put into consideration evidence-based aftercare programs in terms of following the scientific research that needs to correspond with that particular component. Also, wellness will encourage people who are in treatment and recovery facilities to embrace the idea that wellness, as we have seen, is holistic. Just giving medication is good, just doing psychotherapy is good, but you need to do it even beyond the treatment center. And it has to be long-term, as you have seen, is a process. And not just doing two or using two components and thinking that is the end of it. Wellness should be long-term, to go beyond 3 months of the rehabilitation, which is like the standard time that most people will be put into the rehabilitation centers, but also be able to address the possible chances of relapsing. And that means instilling into these people the idea of making sure that they stay away from the drug. They stay without using it. So this brings us to that point where we look at a detailed recovery-oriented system of care. And this is by Dr. Clark, who envisions recovery encompassing wellness, health, and it is always achieved through involvement of a variety of systems of care available in the community. Although many communities may not have all the resources available to them, but recovery management includes, assessing available services and linking the person in early recovery to the systems most relevant to them. And the word that we need to consider there is the most relevant to that person, looking at the culture and many other things that surround that person in recovery. So you can look at that figure and see that the outer layer of the circle, there are 3 words that are appearing very boldly, and that is wellness, recovery, and health. And that means then we need to consider the fact that these 3 are put into consideration when we are trying to achieve recovery, and that means not leaving out wellness by all means. The same figure now being analyzed in a simpler term, you can see that the outer layer of the circle has outcomes. And these outcomes is to help this person using wellness to be able to reach recovery, to maintain resilience for things like relapse that may want to come in. But at the same time, at the bottom, we see health and wellness being the ultimate goals that this person needs to reach to. It goes further to look at that being a global way of defining the wellness in terms of improvement of the global health of that individual. And that will mean their physical health, their mental health, social, emotional, and spiritual health. And today you will see that we'll be talking more about the physical health. On that way, we shall be talking about the nutrition, the sleep, the stress management in the slides to come. So the whole person strength-based approach has many other factors under it. The first one is wellness is multifaceted. It means that we cannot achieve wellness by just applying or trying to teach this person or coach this person through one component. For example, the emotional aspect is to help this person, cope effectively with life issues, creating good relationships, making amends. And we hear about making amends even when we start on the first step of the 12 steps, of the AA. So you can see that comes in as a wellness idea. Also the financial, making sure that as this person recovers, there's satisfaction with current and future financial situations. They might have lost their livelihood, but then we encourage them to make sure that they go back to a life that is fulfilling, as we saw in the beginning there. We also see that there is the aspect of physical and social that's coming in strongly. On the social, developing a sense of connection and belonging and having a good support system. And that's why even as they put together their recovery resources, it's important that we involve the family, but also make sure the person who is the individual going through the recovery process understands the importance of maintaining those good support systems. On the physical, is recognizing the need for physical activity, food, sleep, and so on. And also you can see on the spiritual, which also comes in other processes during the recovery, expanding one's sense of purpose and meaning in life. What are they really seeing themselves to be like in life? Do they think they have just lost it, or do they think they can do better? And that means then we help them to come to that realization. Just a minute. Okay. So we continue and look at now the second point, which is wellness is personally defined. How we address our needs in each dimension depends on the goals, beliefs, values, culture, personality, preferences, and life experiences of the individuals in recovery. So it's important for us to consider the culture of that particular area where this person is located. Maybe he might not do well in a certain way of wellness, but do well in other components, but then continue coaching this person to achieve them. For instance, a person on their recovery journey might find swimming therapeutic, while another might fear swimming because of the past trauma that they might have experienced, but still use the treadmill instead at a moderate intensity. So you see, you have made it personalized for that individual and ensure that they gain something out of that. The third point is wellness recognizes and builds on the consumer's strengths. For example, if a person in recovery experiences voices as disruptive and wants to avoid medication because of the side effects, but still the same person reports voices stop when he or she listens to music. So there's a positive aspect there, which is listening to music. The practitioner may coach the person now on using this strength and many other strengths to manage the voices. The fourth one is wellness aims to increase overall quality of life, healthy habits, and personal control. The practitioner and the person look at all the aspects and decide together. So there's including that particular person in recovery in the decisions that you're making. They create a plan together so that listening to music and using other strategies to manage the voices, as well as steps for developing healthy daily routines, are put together. For example, reminding this person the importance of sleeping enough, eating more nutritious foods, and exercising moderately. Another alternative of the same example in the disease treatment model, which concentrates on what is wrong. And from that example, we have seen is hearing voices. So the practitioner decides how best to solve this problem. He or she prescribes medication, ensures the person is taking the medication as prescribed, helps the person identify the stressors that could be distracting him and causing those symptoms to be worse, and then suggests how to avoid those risks and also to do well in the stress management aspect. The fifth point is wellness actively involves the client in decision making. The practitioner serves as an educator, a coach, a facilitator, and a consultant. If the person in recovery hears voices, the practitioner asks how he or she experiences the voices. So the person may say the voices are disruptive. So as a source of positive guidance, the practitioner asks, what has helped you manage this before? And that's the point now. What worked in the past becomes one building stone to act as a beginning point for decision making between the practitioner and the person in the recovery. Positive involvement is an aspect that comes under that point and should be included. If the voices are disruptive, for example, the practitioner educates the person about possible strategies for reducing them. For example, use of medication would be one way to reduce if it's the psychosis to go away at some point during the day and not just relying on listening to music. Then talks in depth about the side effects of the medication, but still considering that medication is important. So it's not doing away with other strategies, but involving them appropriately so this client can be able to get the assistance that is required. Lastly, looking at the pros and cons of each approach. The sixth one, wellness uses collaboration. For example, the practitioner and the person in recovery work together on finding effective ways of managing voices. The practitioner can say, my goal is to help you meet your recovery goals. This also means the entire continuum of care requires collaboration. Just the same way you collaborate with that individual, you also need to involve other people. And we see from this next slide here, where now the multidisciplinary wellness team or concept comes in, where, for example, in a facility where there is a psychiatrist or a physician who would be able to administer medication or medical tests, there should be a nurse who will be dispensing the medication as prescribed by the psychiatrist. Then the addictions counselor who will do some assessments just to see what could be the other hidden issues that needs to be explored. You know, also conducting psychotherapy. A nutritionist and a dietitian, for example, are important people, educating on eating nutrients that are necessary, meal planning, timing of the meals, and all that. Then a wellness coach also comes in, so that this is the person who will practically drive the wellness agenda, offering skills to support the change process through eating, fitness, rest, relaxation, and stress management. So we now jump into nutrition, and we want to look at nutrition and the substance use disorder physiology. So, for example, opioids are linked to constipation and weight loss for people with opioid use disorder. Alcohol damages the stomach lining, causing malnutrition for people with alcohol use disorder. Heroin has also been shown to decrease appetite and can change a person's state of taste for food. But generally, research provides that evidence that malnutrition is prevalent among individuals with substance use diagnosis. Addiction and appetite impact the brain in similar ways to motivate behavior. And that means malnutrition can increase drug-seeking behavior. Treatment is more effective when nutrition support is incorporated. So this moves us to the next stage now, where we look at the role of nutrition in recovery itself. Nutrition as a component of wellness. So a balanced, nutritious diet provides essential vitamins, minerals, proteins, fatty acids, and carbohydrates, together with water, that are needed for a holistic change for this person. But again, we need to consider, while using nutrition, that proper amounts of nutrients are provided through whatever is consumed. And this will be helpful because they will help in the process of healing to reverse the damage that has been caused by the drug. For example, thiamine B1 given to those people with alcohol use disorder as part of initial treatment is one approach that can be said to be nutritional. Now, let's take one category of drugs, and this is the opioids. So these are tips for opioid addiction recovery. The first one is try to help these people to avoid sugary and refined foods, because these can cause fluctuations in the mood and make it difficult for them to reach their goals. Also, help them to eat foods high in antioxidants. These antioxidants boost immune system and help protect cells from free radicals. And this is also important for protection from cancer. Eating fruits and vegetables is very, very advisable and should be done during treatment and even after. Fruits and vegetables help in the journey by rebuilding the same immune system. For example, very well known for these would be apples, carrots, broccoli, that if you include in the nutrition, will it be helpful for the people with opioids. Protein is important, and protein as a building block, we know it will help in the repair of the liver that has been damaged from the use of the drug. Eating fiber is also very important for digestion, and this one can be found in foods as simple as beans, brown rice, and that is important to consider. Now, during the process of recovery, there are those main meals, for example, the breakfast, the lunch, and the dinner. But in between is important for those people who are on recovery from opioids to do some light snacking. This light snacking will help them to resist cravings, because then, for example, if you're using something like cashew nuts, they have plenty of omega-3 fatty oils. So that will be a nutrition that helps this person by pumping more of the omega-3s into their brain. Then if they have to take something in terms of tea or whatever, like coffee, it's important to choose decaffeinated coffee, because coffee in itself can trigger mood fluctuations that pose a difficulty in the ability to resist drug cravings. So what are some of the other outcomes from healthy nutrition, apart from now what we have looked at the opioids? Healthy nutrition choices in recovery include improving blood pressure. Some of the people in recovery will come in with medical issues as well. So blood pressure can be managed if nutrition is properly provided. Also, taking care of their hair and the skin by consuming things like avocado. Healthy fats are vital because they also help in the blood clotting, proper hormone production, muscle function, and much more. Adequate water consumption should not be forgotten. In fact, proper absorption of these nutrients and functionality of the digestive tract requires that more water is consumed. So those are the general. So on a day-to-day basis, we need to have some specific nutrients that this person consumes. For example, carbohydrates should be consumed in enough amounts. The reason being, carbohydrates provide what we call tryptophan, which helps the brain to produce neurotransmitter serotonin. And we know how serotonin is important, especially for the mood disorders. In the process, sleep hormone melatonin is also increased. Hence, there will be a better sleep and wake cycle just out of eating carbohydrates. The outcome can be reducing cravings for substances, stabilizing mood, and providing healthy sleep for that particular individual. Amino acids, which we have talked about, an example being the proteins, enable the brain to produce adequate amounts of neurotransmitter dopamine, which prevents greater aggression, negative mood, and all that. It's important we provide that in our recovery centers. Dietary fat facilitates what we call the neuroplasticity regeneration that we looked at the beginning in 2 steps. It reduces inflammation and protects the integrity of the cell membranes. How beautiful that is. Omega-3s also decrease inflammation and increase the uptake of neurotransmitters by the brain. And we have seen how that can happen when we talked about the other foods like the cashew nuts. Then omega-6 fatty acids work together with the omega-3s to increase neurotransmitter receptor function and activity so that the process is seamless for that individual to start seeing good results. Exercise is our next point of discussion, which is a wellness component, and research suggests that exercise and physical activity can help to improve stress-related symptoms, depression and anxiety, according to SAMHSA 2019. Further research indicates that increasing the heart rate through exercise also triggers release of serotonin and the feel-good hormones known as endorphins. Regular aerobics exercise reduces, if used as a distractor, the idea of somebody wanting to relapse. So using exercise as a distractor is a very good way, because then it can help them, from what we have seen, to reduce the cravings, lowering the likelihood of relapse. So following discharge from the treatment center, research affirms that exercise can be helpful aspect of addiction recovery and should be continued even after being discharged from the treatment center. And some of the low-cost recommendations that we can adapt at our treatment centers and recovery centers includes walking. Just interval walking will not require you to go to the gym if the gym is very expensive. Body weight strength training. You can do what we call the calisthenics, which is just using your body to execute some of the exercises. Jogging, swimming, rope skipping, stair climbing, all those that will not require you to have the excuse of not wanting to go to the gym. Exercise can also be used to improve self-esteem and confidence, because I'm looking at this individual who has started maybe restoring his muscle tone and losing some weight and looking good. This person's confidence will be improved. It is easier to manage stress when you feel good about yourself, and that is very true. Your physique being in healthy shape helps increase self-esteem and confidence before the people around you. Many people in recovery may gain weight from side effects of medications, calorie-dense foods, and sedentary lifestyle. But the same exercise can be one way to help in reducing the weight. Because we need to remember also, when somebody puts on too much weight, going into obesity, obesity is a risk factor for heart disease, diabetes, and hypertension. Exercise routine can be used to replace triggers. And we know the very common, the people, the places, and the things. So if this person is occupied from time to time, that will reduce the triggers. Someone in recovery will get something to keep them going. According to the National Institute of Drug Abuse, NIDA, 2019, a combination of cognitive behavior therapy and exercise can help people quit smoking. And actually, when combined with nicotine replacement, exercise is more effective at helping smokers avoid to gain weight than just using the nicotine replacement alone. NIDA reports that teens who exercise are not just likely to smoke cigarettes, but also less likely to abuse marijuana than their less active peers. So you can see also how you can use that for the younger people. Archives International Medicine found that women who engaged in vigorous exercise 3 times a week for 12 weeks were twice as likely to succeed in quitting smoking as women who did not. Focused exercise relieves and reduces stress. Both physical and emotional energy can be acquired from that. So let's move to the next component, which is stress management. So there are various ways you can use at your recovery center or the addiction center, treatment center, to ensure that you deal with these stress issues. One of it is encouraging mind-relaxing activities. For example, journaling, using art, using music. We have heard from one of the examples I gave earlier, how this particular client uses music to, ward off the voices that he or she hears. You can also encourage avoidance of stress-inducing foods, just things that have too much caffeine in them, the beverages that somebody may want to take, or taking things that have too much sugar. That can be a challenge. Encourage the stop to breathe. Sometimes, due to the tension and the anxiety that this person has, they just require to pause and just look at things objectively. Encourage a culture of seeking help, encourage a culture of acceptance. And we know once somebody is into the acceptance, it's very easy for them to start viewing themselves differently, start viewing recovery as something that is important for them. Encourage self-care. We have seen how it's important for them to eat, how it's important for them to sleep on time and make sure they sleep enough. Establishing a routine exercise plan for them and encouraging resilience, self-affirmation, talking positively about themselves. That will be important. The other component is mindfulness in recovery. And mindfulness is the awareness that arises through paying attention on purpose in the present moment, non-judgmentally. Mindfulness-based interventions have been studied as a treatment for an array of addictive behaviors, including alcohol abuse, smoking, opioid misuse, use of illicit drugs such as cocaine and heroin. In relation with addiction specifically, chances are that repeated relapse may stem from a limited ability to cope with uncomfortable sensations that are likely the result of an overly taxed nervous system. And that means then, as we can see from this slide, studies indicate that mindfulness-based interventions reduce substance misuse and cravings by modulating the cognitive, affective, and psychophysiological processes, which are integral to self-regulation and reward process. We know how addictions takes really a lot from the reward processing center. And that's now how this can be helpful to capture that part. So as a practitioner, we want to understand the relationship between feelings, sensations, and these sensations might just be the anxiety. It might be the cravings. And once we understand that, it's very easy for us to help this person who is in recovery. So once we know that we are supposed to be taking care of these people and we are supposed to be giving the right nutrition, we are supposed to be helping them manage the stress and all that, it's also important for us as the recovery professionals to take care of ourselves. Remember, you cannot give what you don't have. It is possible that you are providing services, but you're also not taking care of yourself. So it's important for us to make sure that our cups are filled so that we can pour out something from these cups. Professionals need to be in shape physically, mentally, and in their spirit. Remember, when you are taking care of somebody and forgetting yourself, you might just be a victim as well in few days. So some of the tips for self-care include, from the physical aspect, eating healthy regularly, getting enough sleep and rest, including exercise. On the psychological aspect, self-reflection and seeking supervision, not just providing counseling without getting supervision. You know, there's that number of sessions you need to do, and then you seek for support, decreasing stress in your life as well. And that means trying to live a life that is stress-free. On the emotional aspect, trying to express emotion as needed, giving yourself affirmations as well as you give to your clients, also encouraging yourself. From the spiritual aspect, meditating, finding your life purpose, praying, fasting, and even singing are good examples. And in the workplace, ensuring that you balance your day using a planner, for example, you know, taking breaks during work days. And in general, to get a balance, strive for a work-life balance, so that at the end of the day, your work doesn't come into your personal life and your personal life doesn't go into your work issues. So up to there, let me now go into some of the recommendations that I thought would be beneficial for us who are in the treatment and the recovery space. The first one is treatment facilities need to work in collaboration with the fitness, sports facilities, and insurance providers. For example, we have looked at some of the simple ways of providing exercise programs for the people in recovery. That means if you identify a fitness professional that can help you with that, that can be a very good thing, so that exercise is not left out. But it's also important as you bring in this person to make sure that they have or they get some understanding of how addiction works, so that they don't end up again causing the people who are intending to exercise to start doing what we call overtraining, and that can be a problem. Then also treatment and recovery facilities need to embrace pocket-friendly programs, such as having structured walking activities. You know, the World Health Organization has given us very simple guidelines that anyone can follow at the center. And that means just trying to make these people be active, 30 minutes, 5 days a week, which will be about 150 minutes a week. Also, treatment facilities to hire wellness personnel or create room for staff to be trained in that area of wellness, so that as they try to treat or try to take care of those who have left the treatment facilities, they will have a know-how of some of the best ways and evidence-based ways to apply the wellness components. There is need for development of evidence-based approaches that address holistic recovery and being open to new ways that address the transition from treatment to the community. That reintegration of the individual back to the community is very important, and we need to look at it closely. Then there is need to have more people get trained as recovery professionals with a specialization in wellness and recovery, because recovery is one area that has not been given a lot of attention, yet it's very important. I guess maybe that's why we have quite a lot of relapses happening. And also in most of the recovery and treatment facilities, the practitioners continuing to do things the same way year in, year out. Hence, the number of relapses going high. There must be a paradigm shift in how we view recovery. It's a must that it is holistic by integrating wellness, having more, government-funded facilities to supplement the private ones that are already existing. And up to there, that marks the end of my discussion with you today. And now I take it back to Lambert so that we can have questions and any other comments that may come through. Thank you.
Thank you very much, Sami, for that excellent presentation. And I think we will, at this point, give the opportunity to take a few questions. And right here, I can see there's a question from Thika, Kenya. Mm-hmm. And yes. The question is a wellness coach same to a practitioner and sponsor as prescribed in AA programs? You used these terms interchangeably in your presentation, and if so, how can they acquire this important information? Greetings from Thika, Kenya. Good job.
So there's a practitioner, a wellness coach, and what was the last one?
So there's a wellness coach, a practitioner, mm-hmm. and sponsor. Prescribed the AA program. Okay. And so it says that you use this term interchangeably. Yes, go ahead.
Yes, I think thank you so much, Lambert. So I think in the discussion, we didn't use the word sponsor. However, I know sponsors come in when it comes to the treatment space, where, for example, in the AA programs, a sponsor is that individual that will, provide a link for this person to receive treatment. And when it comes to the word practitioner, it's a word that is used broadly, and that's why in this particular discussion, I used it interchangeably, just to make sure that even the coach who is coming to prescribe exercise at the center, or the wellness coach who is coming to design some wellness programs for the people in recovery, would still be regarded as a practitioner, because they are providing that service. And especially if they are from the private sector, then that will be so. But then a wellness coach, again, is an individual that is trained in different aspects of well-being, so that they can be able to provide services that range from, as we saw, nutrition, fitness, stress management, and all that. All this leading to a holistic life of an individual. So that's how I can respond to that question.
Thank you very much. Another question is, what is the difference between wellness coach and a recovery coach?
Wellness coach and
recovery coach.
So a wellness coach, as I said again, he's or she is an individual that is trained or certified to deal with that aspect of well-being. And I've mentioned some of the areas to do with the stress management, nutrition, and enabling this person go into good habits that will improve their health. But when it comes to the recovery coach, a recovery coach also has a different training that is specific to addiction, especially, so that as this person who is in treatment transits into the community, this is the kind of person that can also help by being an advocate, or by providing a space where that person is reintegrated back to the community in a much better and dignified way, helping this person not view stigma as a problem, but understanding that, you know, recovery is a process and needs to be followed through even after they have left the facilities. So the difference would be that a wellness coach might not per se deal with matters to do with addiction directly, but the recovery coach would deal with the matters to do with addiction, especially in recovery.
Fantastic. Another question. This is Anne Juguna, a counseling psychologist from Nairobi, Kenya. Her question is, where can one get training on recovery wellness in Kenya?
So that's a very good question, Anne. I think in Kenya at the moment, I have not come across an institution that is providing recovery per se, but I know programs under ISSUP that are very good, like the Recovery Allies training that has been conducted. Many cohorts have already passed there. And also you can pursue, you know, international studies and colleges that provide that kind of training. However, in Kenya, I haven't come across any institution unless it is there in these recent days.
Thank you very much. I think we still have a few more minutes for more questions.
Yes.
What incentives, this is a question from Pamela, what incentives would be used to attract or convince SUD persons to exercise?
Okay, that's a very good question, Dr. Pamela. Incentives that can attract these people is, for example, buying the person a jersey for exercise. You know, the facility can, you know, be providing the attire or a sports shoe to encourage this person, to motivate this person to, you know, start liking to go into exercise. So things like the sportswear that they can use for the exercise, or involving certain post-workout snacks, you know, telling them, if you went into this workout, there is a snack for you that will help you to build the muscle, that will help you to feel good or, you know, sleep better, things like those. Also, identifying the strength of the person, because you might be thinking of giving them a t-shirt, but for them, they want to swim. So a t-shirt would be maybe used for jogging and all that. But then if you give them goggles for swimming, that can be helpful for that person. So look at what are the things that they have used before, or what are the things that they relate to very well, and use them as incentives for individuals differently. These individuals are different and they may have different likes. And as we saw, also consider issues to do with the culture and, you know, the background of that person, so that we come to give them that which is suitable for them.
All right, I think we'll take the last question.
Yes.
Last question says, thanks for that well-put presentation. I have found that those clients that utilize our gym become well-adjusted and are more positive about the program. But there's also an issue with them becoming very dependent on the exercise to a point of them overstretching themselves physically. Is there a cause for alarm? And if there is, how can I manage that?
Thank you so much. That's a very nice question. So I think what the gentleman is talking about is what we call overtraining, where now this person being dependent on that means it could be the brain is also, you know, releasing the same dopamine as it used to do during their active days of addiction. And that means then it's important now to invite or involve a certified exercise professional to come and write a structured program for each individual, a program that is based on goals. What do I want to achieve at the end of this? Not just working out anyhow. So that as you achieve the goals, you also evaluate them. And as you evaluate them, we look at how far can we go in terms of increasing intensity or reducing the intensity of the exercise. So if those things are put together, and then they are observed over a period of time, it's very easy for you to manage than when this particular person is just led to do the workup. So I believe strongly in involving professionals that are specific to that particular component to assist in coming up with the most relevant and specific approach that will be good for that particular thing that is required. Yes.
Thank you very much, Sami Ombija. And this brings us to the end of our webinar today. As our certificates will be ready in the next few hours, feel free to visit issup.net. Take time to like our page, our social media pages, and for sure, those of you who are going to sleep, good night. And those of you who are waking up and starting off their day, I wish you a very fantastic day. Thank you very much. Ciao.